We're going to navigate now to the next phase of the symposium, where we're going to bring up our first keynote speaker.
Hi, everyone. So as you heard, I am Jazma. I am a postdoctoral fellow at City of Hope. I have the pleasure of introducing our next speaker, Dr. Tamarra James-Todd, Mark and Catherine Winkler Associate Professor at Harvard T.H. Chan School of Public Health. She is an instructor in medicine at Harvard Medical School and an epidemiologist at Brigham and Women's Hospital. Dr. James-Todd evaluates the link between environmental chemical exposures and diabetes, obesity, and related cardiovascular disease risk among women during the perinatal period and beyond. So with that, Dr. James-Todd, welcome.
Thank you so much for having me. I'm really delighted to be here and being able to join you all today. I'm going to, Jazma, if you could let me know if you can see the correct mode of the slide deck.
Yes, I can.
Lovely. Okay. So I'm going to just jump right on in and give a bit of an overview, but I want to start with a question, and I would love for folks to feel free to plug this into the chat. And my question is, how do you define or explain what is beautiful? And I'm just going to give you a few minutes to or a second or so to think about this. What is beauty to you? And feel free to put that in the chat, and just curious. And I think that this question is really relevant to how we go about our day-to-day lives. I think sometimes we feel that beauty might be a very superficial concept, but indeed, it really does drive a lot of what we do, how we interact with the world, and what we put on ourselves in order to perhaps conform or achieve a certain standard of beauty. And on that note, because the title of my talk is Beauty Justice and Pregnancy Health Disparities, I wanted to make sure that we were on the same page about what exactly is beauty justice. And if we were to break that term down, how we define beauty, if we look in Webster's dictionary, is that it's a combination of qualities, many of which can be defined as physical qualities that have some sort of aesthetic sense for us. Ironically or interestingly, the second definition in Webster's is a beautiful woman, which I think it's interesting that beauty is gendered. And also when we're thinking about this term justice, this idea about it being the quality of being just, impartial, or fair. And the idea or concept that how exactly could then beauty have anything or any way of intersecting with something like justice, I think is important. And I hope by the end of this talk, I'll be able to show or present that indeed that this is the challenge here. And it does have health implications. One of the challenges and reasons why those two factors intersect is because there is truly an intersectional component to how we perceive or think about beauty. Our identities and our backgrounds really impact how or what we describe as being beautiful. And depending on where we are coming from, where we live, and so on, there could be real impact on what we choose or don't choose in our ability to try to achieve certain beauty standards. So despite the fact that beauty may be seen as superficial, the reality is that conforming to beauty standards can confer economic power, social mobility, social acceptance, or other forms of validation. And so it's not just an external appearance issue, but it also has internal and even more broadly widespread implications for how we go about, like I said, our day-to-day lives. So to conform to beauty standards, again, depends on kind of what those standards that are set in a broader form. And in the context of living here in the United States, we conform to Eurocentric beauty standards, which is really challenging for women of color because what is seen as valuable or beautiful often is challenged by skin tone, hair texture, fragrance and scent, and other components. So individuals may choose to use skin lightening creams because, and it may not feel like a choice. It's being driven by all those things I just mentioned about conforming due to social pressure and economic benefit. The challenge there is that things like skin lightening creams contain mercury. There's been a lot of focus on hair straightening, and for those of us in the room who, spend time with, as my daughter back when she was 3 years old used to say, out hair. I love my out hair, she would say. And the reality of the matter is that it's not just the every, few weeks, months, maybe a couple of times a year of straightening, but it's also the things that we're using on our hair daily, sometimes, multiple times a week. Those hair maintenance products that are really an issue, and I'll talk more about those shortly. But other things that we might use, such as perfumes, cosmetics, hair removal creams, and even nail polish. Certainly, there have been lawsuits over some of these products, these consumer products that are for beauty purposes. And it's worth noting that even things that oftentimes people don't think of as containing chemicals, such as hair extensions, contain chemicals like flame retardants in them. And so even thinking about the impact of consumer products that we may not fully understand or know what it is actually inside of these products. And then the professional individuals that are working in these environments, in these spaces, day in and day out, and what are those exposures that they may be exposed to. Because at the end of the day, one of the challenges that we have, as I just kind of intimated, is that we don't always know what's in our products. So the products that we use every day can have hundreds of different types of chemicals, ranging from pesticides, plasticizers, surfactants, phenols, and flame retardants. Today, I'm going to be speaking a fair bit about plasticizers and a little bit about phenols. But the point is that we have these chemicals, they have some utility in the personal care products or beauty products that we use. For example, plasticizers, and you'll hear me talk about phthalates, can hold fragrance in products. Phenols can serve as antimicrobials. We're often using our hands for the personal care products that we're using. And so being able to kind of keep the microbes down is a part of that. So there's utility, but the question is, have we or do we have access to safer products that either have vetted what is in these consumer products or have selected safer alternative options to actually have a similar effect. So I just mentioned phthalates, or these forms of plasticizers, and they, again, can be found in a variety of consumer products. I'm going to be speaking a lot about the personal care product phthalates today, but they can be found in diet and food packaging, as well as medical tubing, medications, and plastics. And the challenge here in the case of this justice piece, is that the exposure pattern, or what we're exposed to, is not evenly distributed across the population. So what we know is that women have higher concentrations, and actually this has been sustained over time. We're looking at data here from a nationally representative sample known as the National Health and Nutrition Examination Survey. And it's also clear that there's differences by race, ethnicity. And so here the red bar, it represents non-Hispanic Black individuals, and the green bar represents Mexican American individuals. So the challenge here is much higher concentrations of some of these chemicals, and particularly those chemicals that are found in personal care products, where they are being used to hold in fragrance. So we see that there's this exposure disparity, and we have to kind of ask this question, why? So the why is really in that the ingredients. This is data from the Greater New York Hair Product Study that was run in the early 2000s, and Silent Spring Institute looked at the commonly used hair products by Black women. This may, perhaps you may have heard some of this on a Public Radio International. It was featured on there because every single one of the commonly used hair products contained multiple forms of chemicals that were known to be hormonally active. So again, thinking about what is being put in the product, is it being vetted? And sadly, we don't have a great regulatory system in this country to regulate personal care products. And what is put into products used by women of color may be very different than what is put in products that are being marketed to other individuals. The challenge is, I said that there were multiple hormonally active chemicals in that. And so what happens when you have multiple chemicals? And in the context of thinking about diseases like breast cancer, we know that there are hormone receptors that are involved in breast cancer. So receptors like the estrogen receptor, for example. And what I'm showing you here is where we ran an assay looking at the mixture, so the multiple ingredients of these, so we purchased these commonly used hair products, and we had them tested to see whether or not they ramped up or ramped down or didn't do anything at all to these various hormone receptors. And what I'm showing you is that each one of them was able to really have some sort of impact on these receptors, either by ramping up or acting as what's called an agonist, or ramping down, acting as an antagonist of one of these receptors. The progesterone receptor, for example, is involved in a variety of processes, including pregnancy, labor and delivery. The androgen receptor, you think about testosterone and reproductive health outcomes in the context of women. Conditions like polycystic ovarian syndrome can be impacted. And then with respect to the glucocorticoid receptor, this is a receptor that can be involved in a number of processes, but particularly diabetes, for example. So each one of these has some impact, which is problematic, because when I think of what I want to do when I go to the store, I don't want to think that what I'm using or purchasing from the store would have any impact on my body's hormone receptors or hormonal processes. So what does this have anything to do with pregnancy? And so I want to just give you a little bit of background about pregnancy health disparities. So there in the United States, we have fairly striking health disparities when it comes to pregnancy. And I'm sure that many of you all are perhaps familiar with some of them. Non-Hispanic Black women are 50% more likely to experience a preterm birth. Also, American Indian and Alaska Native women are also are individuals who are much more likely to experience preterm birth. When we're looking at common conditions like gestational diabetes, this affects approximately almost 10% of all pregnancies here in the United States. What we see is striking differences not only by race, ethnicity, but also by place of birth. So that individuals who are of Asian and Hispanic origin are 2 to 3 times more likely to experience a pregnancy complicated by gestational diabetes. Both preterm birth and gestational diabetes confer increased risk of a variety of chronic diseases in the future, including adverse cardiometabolic health outcomes like type 2 diabetes. And there's recent data to suggest that there's associations with breast cancer risk. Hypertensive disorders of pregnancy are also quite common. And what I'm showing you here is that Black women are much more likely to experience a hypertensive disorder of pregnancies. Conditions like preeclampsia or gestational hypertension are more likely to occur. And lastly, we know that there is a Black maternal mortality crisis, with Black women being 3 to 4 times more likely to experience or die in the period around childbirth. And this is very similar for American Indian and Alaska Native women as well. So, what is it? What's driving this? I just showed you a bunch of complications. And, when we get to the point where we see these striking differences in pregnancy-related deaths, one of the things that is most driving this is this data that comes from a research group that looked at the 5 top reasons for maternal mortality. And what you're seeing here is that it's really around a lot of cardiometabolic conditions, embolism, preeclampsia, and eclampsia, as well as cardiomyopathy. So, what does that have anything to do? What did these conditions have anything to do with, environmental conditions, for example, particularly beauty justice related issues? So that's really the crux of the question. And I hope that I can also share with you what we can do about it. So this is data from a pooled set of 16 different cohorts here in the United States. The pooled sample resulted in over 6,000 pregnancies, and we were looking at preterm birth. This is from a consortium group looking specifically at phthalates, these chemicals that can be found in personal care products. And what I'm showing you here is overall, we see that phthalates, or these chemicals in personal care products, are associated with an increased risk of preterm birth, and particularly some of these phthalates that are found in things like nail polish, for example. And so that's quite worrisome that we, again, have these chemicals in our consumer products and that they may be associated with conditions like preterm birth. But is using a consumer product, or in this case, for example, like a hair product, even associated with higher phthalate or chemical exposures? And what I'm showing you here is hair oil use, which is quite common in the Black community, is associated with much higher concentrations of these chemicals. This is data from a pregnancy cohort called the ERGO study. So we're looking at pregnant individuals, and we asked individuals to report their hair oil and other hair product use. And then we collected urine samples and measured the chemicals around the time of their product use to understand whether or not there was associations. And so you see that individuals that use hair oils have 125% higher monoethyl phthalate. This is a metabolite of diethyl phthalate, a phthalate that is used to hold fragrance in products. And so they have much higher concentrations of this compared to people who did not use hair oils, for example. But what about pregnancy complications, things like preterm birth? So what we found specifically was that hair oil use was associated with an 8-day earlier delivery in this same population of individuals. And that, again, is quite worrisome. There's very few things that really confer that degree of earlier gestational age, particularly environmental factors. And it was specifically looking at late pregnancy, so the time period in which somebody's gearing up to deliver. So is it possible that in this case, we might be able to encourage people to reduce, for example, their hair oil use or the use of fragranced hair oils to perhaps reduce the increased risk that we see associated with preterm birth, particularly among Black women? We also looked at birth weight, and it's worth mentioning that both Black and Asian women are 2 to 3 times more likely to experience a lower birth weight infant. This has a variety of adverse consequences, both for the pregnant individual and their offspring. And what I'm showing you is that use of hair oils, again, and hair oils seem to be kind of the bad actor here. We're kind of digging into the why behind that right now. But this seems to confer a 300 gram lower birth weight if you are a hair oil user compared to if you are not. Lastly, going back to these cardiometabolic, again, primary cause of this Black-white differential in maternal mortality. And so when we're looking at postpartum cardiometabolic health, I'm showing you fasting glucose here. This is an indicator of adverse cardiometabolic health if you have elevated glucose levels. And I'm showing you here that individuals who reported use of hair gels, hair oils, and leave-in conditioners had higher fasting glucose, particularly those with hair gel use and hair oil use in the postpartum period. It's on the order of 3 to 10 milligrams per deciliter higher, which is not trivial. So the question really is, what can we do about this? And part of what we can do about this is starting to ask the question, why? And I think part of that why is certainly constructed around what we define as beauty, which is why I wanted to start with that question. But it's also around what is available to us, and that there are structural factors that really have implications for what we're exposed to and what we have access to. In the context of historic redlining as one of those structural factors, this is a policy that was enacted in the 1930s and 40s that restricted homeowner and mortgage lending to certain communities. So communities that were predominantly white and higher income were allowed to borrow money to purchase homes, whereas communities that were predominantly people of color or immigrants were not allowed to do so. And those were identified as redlined communities. This has had implications on wealth accumulation and also implications for what people are exposed to within their communities. There's higher air pollution, increased or lower access to healthcare services, less green space, and a variety of other things. But when we're thinking about personal care product use, one of the issues is that safer product use is also disparate in these communities. This is data that comes from Marissa Chan, an amazing doctoral student working within our environmental reproductive justice lab, and it's featured on our environmental racism story map, where I'm showing you that individuals that live in predominantly communities of color or lower income communities have less access to safer products and much higher access, unfortunately, to products based on Environmental Working Group Skin Deep database that are identified as being hazardous. They also have greater access to leave-in products compared to rinse-off products, which could also lead to an accumulation of these hazardous ingredients in products. So some of the ways that we are taking action to really reduce exposure disparities that are linked to these adverse pregnancy outcomes and really contribute to pregnancy health disparities is by actually working with the healthcare professional workforce. So we have designed interventions to actually work and educate and improve environmental health literacy in healthcare professionals. And I think one of the keys here is recognizing that many healthcare professionals, despite their being experts in healthcare, have limited knowledge of these consumer product chemicals and don't know how to counsel their patients on reducing exposures. So this is a missed opportunity if we did not take this chance to actually educate them and to develop and increase their capacity to actually improve health outcomes. We're also working with community members through farmers markets and other community events to provide demonstrations, resources, and other opportunities, including clinical fact sheets, to make community members aware of these chemicals. We also run environmental justice youth summer camp and have partnerships with a number of community organizations to do this work. I encourage you to also visit our environmental racism story map that I just mentioned as another resource that also provides educational opportunities, not only to adults, but also to younger people. I want to acknowledge and thank my team. Without them, I could not have done this work. And also thank our funders. They again, a really amazing opportunity to really go from doing this lab-based work all the way to really being able to translate this to the community and hopefully take action to reduce environmental reproductive health disparities. On that note, I can take any questions.
Dr. James-Todd, thank you so much for that insightful presentation. You really gave us some good tips there. And I want to encourage the participants, if you have any questions, please send them to admin questions. We do have one question for you, Dr. James-Todd. Can individuals request to have a urinary phthalate metabolite test, or is there any tests that individuals can take to help better their health?
Yeah, that's a great question. So there are organizations such as Silent Spring Institute that do provide and offer resources in which one could provide a urine sample. You would have to pay for this, but you would obtain a report That report provides information about your levels of these chemicals in comparison to the rest of the US population, as well as information to provide strategies to reduce your exposures to this. Thank you for putting that in there, Dr. Teteh.
That's amazing. So that's great that that's something that we can do on our end as just regular consumers, right, in our daily lives. So once again, I want to thank you, Dr. James-Todd, and to our audience, stay tuned for more amazing sessions.